Hi, my name is Courtney Huber. I am a nursing student at Southeast Missouri State University, and this is my medication administration video. So first I'm going to read the 6 rights of medication, which are right patient, right drug, right route, right dose, right documentation, and right time. So I'm going to be giving Miss Jenkins 2.5 milligrams of warfarin at 1800 hours today. So I would check the MAR and the physician's order to make sure that they match. And the physician's order says 2.5 milligrams by mouth daily. And then Miss Jenkins' MAR says 2.5 milligrams by mouth at 1800 daily. So now, since I have verified that those medications match, we're going to go over some effects of this drug. Warfarin is an anticoagulant. It inhibits the hepatic synthesis of vitamin K, which thus inhibits the clotting factor. So basically, it's just helping prevent blood clots. Miss Jenkins is receiving it because she recently had hip surgery, and also she has a history of diabetes, AFib, and hypertension, so she is high risk. 5 side effects that I would associate with this medication are blood in the urine, vomiting blood, dark tarry stools, petechiae, or any just discoloration of her skin if it looked like blood was pooling underneath it. Vital signs that I would monitor would obviously be heart rate and blood pressure, and then we would also monitor her PT and INR. Her PT is 18, and then her INR is 2.2. Normal ranges for INR are about 1.3 to 2, but since she is on warfarin, her therapeutic level should be between 2 and 3. And then next, I will come back and administer Miss Jenkins her warfarin. So I'm about to come into Miss Jenkins' room. As I come in, I'm going to wash my hands, introduce myself. Hello, Mrs. Jenkins. My name is Courtney. I'm a student nurse. I am here to administer your warfarin. I would double check her identity by asking her name and date of birth. Miss Jenkins, can you tell me your name and date of birth? I'll double check it on her wrist. I'm going to ask if she has any allergies or if she's ever had any adverse effects to this medication. Miss Jenkins, do you have any allergies that I need to know about? No? Okay. Have you ever had any side effects from this medication? Yeah, I heard that you had gotten a little nauseous before. So she has reported nausea with this medication before. I'm also going to assess her pain level. Miss Jenkins, on a scale of 0 to 10, 0 being no pain and 10 being the worst pain you've ever felt, can you tell me your level of pain right now? Okay, she tells me her pain is at a 3. Next, I'm going to tell her why she's getting this medication. Miss Jenkins, you're receiving warfarin today because of your history of AFib, hypertension, and your diabetes, and also your recent hip surgery. All it does, it's an anticoagulant, so it's basically just making sure you don't get any blood clots. So after I describe to her what the medication is, I'm going to tell her some side effects she needs to look out for. Miss Jenkins, I know you said you were nauseous before, but some other side effects you need to watch for would be blood in your urine, or if you are vomiting blood, if you notice any petechiae, which are little red dots on your skin, or if you notice any blood pooling underneath your skin, or if your stools become dark and tarry. After I describe to her the side effects, we are going to do some patient teaching, such as not taking aspirin while you're on this medication, telling her foods that are high in vitamin K, such as leafy green vegetables, telling her that she doesn't necessarily have to stop eating those, but just to stay consistent with what she consumed before so her levels don't go out of whack. And then I'm going to ask her if she has any questions. Miss Jenkins, do you have any questions for me? No? Okay. So now She doesn't have any questions. I've told her everything she needed. We're gonna do our 3 med checks. So I'm gonna pull the med from the drawer, and then I'm gonna compare the medication with the order. So the order is 2.5 milligrams of warfarin by mouth daily. And then I have pulled 2.5 milligrams of warfarin from her drawer. So I know that that's correct. Next, I'm going to place her medication in the cup. And then I'm going to check again. So I'm going to check that I have 2.5 milligrams of warfarin. I'm going to compare it with her MAR, or the order, and those are correct. And then my third check is whenever I'm giving it to her. So I'm at the bedside. I'm going to administer it to Miss Jenkins. We've checked again that we have 2.5 milligrams of warfarin with her MAR. Miss Jenkins, I'm going to go ahead and give you your medication. Would you prefer to take your meds all at once or one at a time? She wants to take them all at once. Excuse me. So Miss Jenkins, I'm going to go ahead and give you your medication. There you go. I'm going to give her some water or sugar-free Gatorade since she's diabetic. Would you like some Gatorade, Miss Jenkins? Okay. Did you have any issues swallowing that? No, she said everything went down okay. Is it okay that your sister's in the room, Miss Jenkins? You don't have any issues with that? All right. Excuse me. Excuse me. Okay. So she didn't have any difficulty swallowing. Now I'm going to make sure she's comfortable. Her bed's going to be in the low locked position. Her call light is going to be in reach just in case she has any effects that I need to know about or she starts feeling uncomfortable. All right, Miss Jenkins, I'm gonna leave you here. Just hit your call light if you need me to come back. So after leaving the room, I would wash my hands. I would make sure and take the medication with me out of the room, obviously. I would document on the MAR that I gave her 2.5 milligrams of warfarin at 1800 hours. And in about 30 minutes, I would come back and check on Miss Jenkins and make sure she's not having any reactions or any adverse effects. I would also monitor her vital signs as well as her PT and INR. And that was my medication video.